it was so much more comforting to see people following medical evidence, having clear guidelines, clear expectations, clear requirements, which they actually explained to us and spoke to us as if we were human beings with brains who were capable of understanding what was going on. Hey, it's Vlasta here. Thanks for being with me today. So I am a 30-year-old pre-med student. I am a new mom. I recently gave birth to our first baby. He's a happy, healthy little guy. We love him so much. And I am really happy with how his delivery and everything turned out. And I wanted to share my experience so that other pregnant people who might be having a breech baby know that you're not alone. It is a variation on normal. Here in the United States, breech births have become something that is hyper-medicalized. Most doctors don't even necessarily know how to perform a breech delivery. Most doctors have been taught that breech deliveries are unsafe, but the crazy thing about this is that the medical evidence disagrees. It's really frustrating to me anytime I see medical inertia or practices that are not evidence-based being used kind of ubiquitously and people just not even really thinking about it or questioning it. So I'm primarily going to be talking about my personal experience. As I mentioned, I am a pre-med student. I am not a doctor. I'm not trying to give anyone medical advice. I'm just trying to spread information that I found. So I'm going to include some different links to videos, guidelines, and studies, which you might find useful if you're in the situation of having a breech baby, but also share my experience and my story of having a breech delivery in the United States without having a C-section. So we found out that our baby was breech at about 35 weeks. We had gone in for a growth ultrasound that our doctor had ordered because I was measuring a little bit small at our prenatal check. The ultrasound tech was great. She was a really lovely person, but she did mention the baby was in breech position. And I was like, oh, okay, I knew what that meant. I knew that that meant that the baby wasn't head down. But as far as I understood, this wasn't necessarily something to be overly concerned about. I did go and I found a bunch of scientific studies, including an NIH study, which said breech deliveries are okay, they're fine, they can be perfectly safe as long as, basically the doctor is trained in what to do, no problem. And I was like, okay, great. But then when we received the call from the nurse a day or two later, our baby turned out to be growing perfectly fine. He was maybe a little bit lower percentile, but that he was breech and therefore we would be needing a C-section. This was really surprising to me because, as I said, I just looked up a bunch of medical evidence that was like, yeah, it's fine. Breech babies happen. The nurse had mentioned some things about risks of, cord prolapse and things like that. And I went and I looked, and most of the data said, yes, there's increased risks around giving birth to a breech baby, but unless the baby is in one of the more extremely rare positions, like a transverse, where the baby is sideways, or a footling breech, then it's fine. There's frank breech and incomplete breech and complete breech, which are all, different types of positions the baby can be in with their legs. But essentially, breech baby is butt first instead of head down, which is the typical thing. So they scheduled us with one of the physicians to discuss having a C-section. So I went in and I kind of did question the doctor about, is there any option for me to have a vaginal delivery? No, there's this really big risk of cord prolapse, and if the cord prolapses, your baby's gonna die. She was a very nice doctor. I don't think that she meant anything by it. It seemed like everyone was just completely disregarding the risks of having a C-section to me, which I guess I shouldn't be entirely surprised by, because I unfortunately know a bit about medical history and the lovely paternalism that basically founded OBGYN care in this country. A lot of times pregnant people have a tendency to be disregarded. Oh, you'll just have a C-section, whatever. Okay, but is that really medically necessary? I know I'm not a doctor. I have at least taken some advanced undergraduate science courses which have taught me how to evaluate studies and sources on things. And from what I can see, having a breech baby is actually fine. So it was this disconnect which a lot of people who have breech babies run into, of like, you can find the medical evidence and the scientific data that says this can be perfectly fine, and then your actual providers and physicians are looking at you and telling you if you deliver your breech baby vaginally, you're essentially killing your baby. That was the vibe that we continued to get anytime we would talk about, like, maybe we don't want a C-section. I'm going to include a link to a podcast interview that was done with the founders of Breech Without Borders, which is a nonprofit organization that's working to essentially reskill doctors and providers in being able to perform breech vaginal deliveries, because our medical education system basically just decided we don't need to train doctors how to do this anymore. We can just do C-sections. C-sections are a skill that doctors already have, even for typical head-down babies. Having a breech baby born vaginally requires a different set of skills. Those skills need to be maintained, which is not always easy if you don't have a high volume of breech deliveries happening at a hospital. And also issues in the 1900s where physicians were basically performing breech deliveries as kind of extractions using maybe forceps or other types of tools, which did probably make deliveries more dangerous. But if you listen to that interview, what they go over is that the medical data actually says, yes, there is a statistically significant increased risk of neonatal morbidity and mortality between cesarean delivery of breech babies versus vaginal delivery of breech babies. But the actual number is 2 out of 1,000. So that's 0.2%, which is a very small number. And comparing that to the same neonatal risks for typical head-down babies who are born vaginally, those are 1 in 1,000. But we're not universally recommending that everyone has a C-section for a typical head-down baby. These things don't make sense. If you actually look at the ACOG guidelines on breech pregnancies, they say that the decision should be a discussion between the patient and the physician. We decided to have a vaginal breech birth with our baby because we could find a physician who was trained in how to do this. But we faced this huge amount of fear-mongering and scare tactics from the physicians who essentially didn't know what the they were talking about. Now, this is not me saying that there's anything inherently wrong with C-sections. C-sections are a miracle of modern medicine. They have saved countless moms and babies, and it is wonderful that C-sections are available for people who really need them when it's medically necessary, or if someone honestly just prefers to do that, that is their prerogative. But the point is that it should always be a discussion. It shouldn't ever be an assumption that somebody will just have a C-section or have any type of surgical procedure just because we're doctors and we say so. So we ended up being recommended to have an ECV, and I'm going to link a video from a YouTuber named Dr. Perez, who did a really nice description and explanation of what an ECV procedure is, which is basically trying to get the baby to flip so that they are head down by pushing on the outside of a pregnant person's belly. Personally, it was a really rough procedure. This is not something that I would recommend to somebody as a recreational activity. It was tough. The hospital where we had it done told us ahead of time that it depended on the physician doing the procedure whether or not they used a spinal or epidural. It just so happened that we got a doctor who didn't do that when they performed the procedure. Having not had the anesthesia, I don't know how much better it could have been if I had had it, but I think I probably would have appreciated it given the amount of pain that I was in. They do still give you a type of muscle relaxant to prevent your uterus from contracting, and they did give me morphine and Tylenol, which might give you an indication of how painful it was. So they tried 3 or 4 times, and it's basically just a whole lot of physically pushing and turning with the hands to try to push the baby to go head down. But they have to use a lot of force because they're pushing through the muscles of your abdomen and the uterus and trying to basically grab behind the baby's head to get them to rotate into the head down position. Each time that they almost got his head down into my pelvis, he just would pop his head back up immediately. So he was just completely unbothered and was just like, nope, I'm just not going to be head down. That's just not happening. And directly after the procedure, I was in so much pain that I actually was physically shaking, and that's never happened to me before, so it was a little bit scary. If you're not really invested in having a vaginal birth and you're okay with having a C-section, I honestly wouldn't recommend just going through that. So after the ECV procedure didn't work, I panicked. Honestly, I went home and I was just thinking, they're going to cut me open. They're going to make me have this surgery. So I basically started calling around to every hospital in the area that had a labor and delivery department. The scary thing that I heard from every single one of the hospitals was that if I showed up at their hospital in labor and my baby was still breech, they would just immediately take me to the surgical suite to have a C-section, and there would be nothing that I could do about it, essentially. Which seems like it should be illegal. You shouldn't be able to force somebody into a surgical procedure if they're telling you they don't want it. I kept calling around to hospitals until I called a hospital about 2 hours away. The nurse that I spoke to there said, you should call this other hospital that was an hour further away because they have a breech program there. And I was like, okay. At that point, that is 3 hours away from me. I don't know if it's practically feasible in any way to drive 3 hours while you're in labor to deliver a baby. At that point, I was so desperate. I was like, I'm just going to call them. And they referred me to the physician's office where the doctor who runs the program practices and oversees a team of midwives who perform vaginal breech deliveries at their hospital. So they have a whole team that is specifically trained. They do recurring trainings every month with their breech team, which includes nurses, midwives, physicians, medical residents, and medical students. It's a whole system of people who are dedicated to performing vaginal breech deliveries. So we arranged to have a consultation with them and drove 3 hours. They had a whole extensive set of criteria which would allow you to be eligible. Essentially, the requirements boiled down to the fact that your pregnancy was otherwise healthy, there were no anomalies with the baby or yourself, and your baby wasn't way too big or way too small. So we had this appointment with one of the midwives. She explained everything extensively. And they had this whole series of diagrams and pictures which showed this is what is typical to happen as the baby moves through the pelvis and out the birth canal. And these are the different movements that they make. And if these things are not happening, these are the exact interventions we will do in order to help the baby to move through. But we want to remain as hands-off as possible and basically just coach the person who's giving birth through the process. And they generally don't recommend having an epidural because that prevents the birthing person from being able to move around to adjust as is needed for the baby to be able to work with them and move through the birth canal. It was so much more comforting to see people following medical evidence, having clear guidelines, clear expectations, clear requirements, which they actually explained to us and spoke to us as if we were human beings with brains who were capable of understanding what was going on. That is not how OBs seem to treat pregnant people for some reason. We did talk to them about the fact that we were 3 hours away. They said they thought that it would be fine if we drove down while I was in labor, especially given that this was going to be my first baby. Typically those labors go on a little bit longer than subsequent deliveries do. They just recommended that we started driving earlier on in me having contractions. After we left, we were like, okay, that's great. And we saw them for our 39-week check. We then drove home the 3 hours from that appointment. And I woke up the next morning at around 5 or 6 a.m. with contractions. After about an hour-ish of that going on, I was like, yeah, this is probably it. And I woke up my husband because I had been just letting him sleep so that he could drive the 3 hours again down to the hospital. My contractions were really kind of all-consuming, and like I had to stop anytime that they were happening. I didn't think that I was actually in labor, and part of that was that my contractions were coming very irregularly. So I really just was like, oh, it can't be, because they say they have to be like evenly spaced in order for it to be really the real contractions. But they were never actually evenly spaced. And the reason that we kind of started still at that point was because I had tested positive for group B strep earlier in the pregnancy. They said if my water broke, even if I wasn't fully in labor yet, I should head to the hospital because they would want to start me on IV antibiotics. We started driving down, and it was a tough drive. And we eventually made it to the hospital, and at that point, about a minute out from the parking garage, I actually felt like I needed to push, which I was like, that's weird. This should not be happening right now. And luckily my husband spotted a wheelchair because I just couldn't anymore. I was just really having a rough time. And the contractions were getting closer together, obviously. And I was just basically the entire drive and through that point concentrating on just breathing every time a contraction came. Just breathing. That's all I could concentrate on. So then he wheeled me into the hospital. And at that point, I wasn't even really able to answer anybody's questions about anything. My husband was just answering all of their questions, and he had been timing my contractions very helpfully in the car as best he could, just looking at the clock. They got us set up in a room. They brought in the Breech team, which is just a lovely group of people who I love so much. And pretty quickly, they got the ultrasound out because they needed to check the position of the baby to see if he was still breech. I started again feeling like I needed to push, and they realized that that's what was happening. And at this point, I had been in labor for only 6 hours. So they helped to start coaching me through pushing. They had me move in different positions. They had the table set up in such a way so that I could be kneeling and I could hold the back of the table to help stabilize myself. And I was only pushing for about an hour before my baby started what they call rumping instead of crowning, since it's bum first. So at that point, they had explained to us that once the baby starts rumping, you have 7 minutes to deliver the baby. Because of the way the baby's coming through the birth canal, the umbilical cord can become compressed at a certain point since their belly is coming out before their head, and the head is wider, obviously, so it's a little bit of a slower progression. And so at that point, they told me, your 7 minutes is starting now. From when my baby started rumping until he was fully delivered, it was only 3 minutes, which is absolutely insane to me. And the fact that I was only pushing for an hour and I was only in labor for a total of 7 hours is also just completely astonishing to me. That is a luck of genetics and feeling like I am comfortable with the providers who are giving me my care. There's no way that that could have happened if those two things weren't the case. And I know there's going to be a lot of people who have given birth who might hear that and say, wow, you really just got through it that fast, huh, on your first one? And maybe be a little mad, and I'm sorry about that. But that's just what happened. And I'm very grateful that it was so fast and it went so smoothly. I'm glad that we actually made it to the hospital in time, because apparently if we had left an hour later because I still wasn't sure I was actually in labor, then we actually might have had a problem. My baby was born perfectly healthy, and they typically try not to cut the cord too early. When breech babies are born, apparently it's perfectly typical for them to be a little bit slower to start responding and to start moving around and making noise. That's just how it is. And so the NICU team is a little bit jumpy about that, and they typically want to, immediately grab the baby and make sure that they're okay. I was still pretty out of it. The whole time I was in labor, again, I was just concentrating on breathing, and most of the time that I was there pushing and in labor in the actual hospital, I had my eyes closed. So I really barely visually saw anything that was going on around me. So my baby was delivered, and the NICU team did not immediately come and grab him because he immediately started crying. He was just beautiful and healthy and screaming. And so they just left the cord attached for actually probably about 3 minutes, and nobody even necessarily realized. They just basically helped me to pick him up and turn around so that I was sitting upright on the bed and was holding him. And it's just still such a surreal thing to me, and it's still a blur because, again, I had my eyes closed for most of the time, and then all of a sudden he was just there. And obviously it was tough. It wasn't like I didn't know what I was going through. There were points during the pushing and the delivery where I was like, I don't know if I can keep doing this, because I still somehow was convinced at that point that this was going to be going on for hours, because everybody had always told me, when you have your first baby, you're going to be in labor for 24 hours and you're going to be pushing forever, and it's just going to be a super long process. So with how intense it was, as quickly as it was, and being convinced that there's no way that I could be as far along in my labor as I was, I thought this was going to be continuing for hours and hours and hours. And so I was like, I can't do this for hours. There's no way I can just keep doing this. This is too intense. And it was just because I was farther along than I thought I was. So then I'm sitting up and I'm holding my baby, and my husband is there. We also had a doula, and my doula was there. They had been there helping me the whole time. My husband had been holding my hand and being his wonderful self. And the doula had been there getting me, cool cloths to put on the back of my neck, getting me water so that I could drink when I could. And the whole team, the entire time, was coaching me and just talking to me and explaining everything. And it was such a wonderful experience, and I don't think that even if my baby hadn't been Breech, I would have had that type of experience with the providers that I had been seeing throughout my pregnancy, because these providers clearly were invested in patient autonomy, patient choice, treating pregnant people as if they are actually human beings. The NICU team did his health assessments at the bedside, which they also said had never happened in the history of their Breech program. They always took the baby away to the warmer to make sure that they did all their checks, but they just did it there while I was holding him and then left. The midwife who was in charge of my delivery, she had previously been a neonatal intensive care nurse. And so she had seen a lot of babies come in with a lot of adverse complications who were Breech babies. After our delivery, this nurse said, "You made such a huge difference to me, and this really changed my outlook on this. This is what we should be doing. We should be offering this to moms who are having healthy pregnancies and want to have a vaginal delivery." And they told us our delivery was a textbook Breech delivery. The baby went through all of the movements that babies typically go through. They said it was better than the training videos, how exactly he went through all the movements and how well everything went and how quickly everything went. So I'm just really glad that this helped other people as well, which is part of the reason I'm putting this video out also, because I want to tell people this is something that's possible. Now, the big asterisk on all of this is that we were able to find providers who were trained in how to perform physiologic breech birth, which is the type of birth that the founders of Breech Without Borders advocate for teaching to providers, where there is as little intervention as possible with the delivery itself, only intervening if there is a deviation from what you would expect the mom and baby to be doing throughout the labor. Had we not been able to find providers who were trained in this, we were going to go through with a planned C-section. I did not want to be in a situation where we had to have an emergency C-section, because that would just make everything more stressful for me and for the baby. We had also had a suggestion from our doula that we could try to contact some midwives who worked with home births who might be trained in how to perform breech deliveries. I'll link a video that I found very helpful from Mama Dr. Jones. I love her videos. She's a great OBGYN. She did a whole video on the risks versus benefits of home birth. I personally would not do a home birth myself, especially for a first pregnancy and especially not for a breech baby, because those are just additional risk factors that make it not worth it to me. If you are in the situation where you have a breech baby and you want to see if there's a provider in your area who will perform a vaginal breech birth, Breech Without Borders has listings on their website of physicians who have submitted to them that they perform breech deliveries. You can also obviously try to reach out through your physician if they are open to it, or doulas or midwives in your area. So it is possible to have a breech baby. Having a breech baby, according to science, is something that can be done safely. And it's something that doesn't require huge amounts of medical intervention. So our medical system is doing a huge disservice to people who have breech babies by forcing them into surgical procedures that they don't need to have if doctors were just properly trained. It's something that's important to talk about given our maternal mortality rates. It's something that needs to be addressed. And I hope that this is something that some YouTube doctors like Mama Dr. Jones or Dr. Mike, who are two physicians that I really admire and follow and want to be like when I become a physician myself, will pick up and talk about this topic, because it's really a big and important example, I feel, of paternalism in medicine and medical inertia impacting people in a really negative way. And it's an issue that should be resolved. It's something that should be easy to resolve by simply training physicians in how to perform these deliveries in an evidence-based way. All physicians should be striving to perform evidence-based medicine. And clearly, there is a lack of education in physician training, but also a lack of awareness by existing physicians who should be reviewing current medical data and current medical guidelines on these type of pregnancies. And I hope that this might help some people out there who are currently pregnant and might have a breech baby, or know somebody who has a breech baby, so that you know that it is possible to have your baby not through surgery if you can find a provider who is actually trained. And hopefully you can bring your baby into the world in the way that you think is best. But if you end up having a C-section, whether you just decide that that's what's best for you, or because that's the only thing that's available to you, that's okay too. It's not something that should ruin the happiness of having your new baby. So thanks again for being with me today. I hope that you found this video helpful. If you did, feel free to subscribe to my channel. I'm planning on putting out some more content related to the medical system here in the US, as well as some other topics that interest me related to my journey to medical school and other things like that. So feel free to subscribe, and we'll see where this channel goes.